Hospitals. Hospitals were built for a very simple purpose. Someone is sick, someone needs help, and trained professionals come together to care for that person. That is the heart of medicine. Every structure around it, nurses, doctors, laboratories, operating theaters, imaging departments exist to support that moment when a patient arrives needing care. But if you spent enough years inside a modern hospital, you begin to notice something quietly changing around that care. The hospital is no longer just a place of care, it has become a bureaucracy. And like all bureaucracies, it slowly develops a life of its own. Doctors are not naive about complexity. Medicine has always been complex. We deal with uncertainty every day, difficult diagnosis, incomplete information, time pressure, life and death decisions. That is part of the profession and we accept it. What frustrates many clinicians today is not the complexity of medicine. It is the complexity of the machinery surrounding medicine. Over time, the system accumulates layers, layer upon layer of management, layer upon layer of approval, layer upon layer of committees, governance groups, review structures, oversight panels. Each one is introduced with good intentions. Each one promises better safety, better accountability, better efficiency. Yet somehow the system becomes slower. A doctor identifies a problem, a nurse raises a concern, a department proposes a change. The issue begins its long journey through the organization. It goes up the chain, it is reviewed, discussed, documented, escalated. Then it comes back down the chain again. More consultation is required, more clarification is requested. Another meeting is scheduled, responsibility moves upward when something goes wrong, authority moves downward when something must actually be decided. Somewhere in that circulation, the decision itself quietly disappears. Meanwhile, meetings multiply. Hospitals today are full of them. Strategy meetings, governance meetings, operational meetings, planning meetings, review meetings, meetings to discuss problems that everyone in the room already understands. The remarkable thing about these meetings is that the people inside them often already know the solution. But the meeting is not really there to solve the problem. The meeting exists to demonstrate that the organization is addressing the problem. Process replaces progress. Along with the meetings comes a new language. Hospitals once spoke in very simple terms: pain, infection, bleeding, recovery. Today, the vocabulary sounds different. You have strategic alignment, stakeholder engagement, operational frameworks, service optimization. The language sounds intelligent and impressive, but sometimes it serves another purpose. It fills the room with activity while saying very little that is precise. Clear problems require clear actions. Bureaucracies prefer beautiful vagueness and bombastic words. Over the past decade, another development has quietly appeared in healthcare. There is now a formal pathway for doctors who move directly into medical administration after graduation. Leadership programs, health management degrees, and structured training schemes prepare doctors to run hospitals after very little clinical experience. In many ways, these programs resemble a specialized MBA for healthcare. The idea sounds reasonable. Hospitals are complex institutions and they do need leadership. But the pathway itself reveals something about the direction the system has taken. A doctor can now move quietly, quickly. Mm. A doctor can now move quite quickly away from medical clinical work into management roles. Soon they are managing departments, budgets, performance metrics, and strategy planning. The medical degree becomes the credential that legitimizes authority within the bureaucracy. Yet, the daily work increasingly resembles corporate administration. From the outside, it looks reassuring. Doctors are running the system. From the inside, the experience can feel rather different because the priorities of the system remain the same: efficiency, targets, budget performances, operational metrics. The presence of a medical degree in the boardroom does not necessarily bring the bedside perspective with it. In fact, the further someone climbs in the administration ladder, the further they move from everyday realities of clinical care. They talk as though they know it, but it's only talk. Eventually, the hospital begins to resemble a large corporate organization. Head of this, director of that, executive above executive. Layers of authority stack carefully on top of one another until responsibility becomes strangely diluted. When a difficult clinical decision reaches the executive level, an interesting dynamic often appears. On paper, they look to be people with authority. They hold the titles, they hold the power to approve or deny. Yet, when faced with real clinical uncertainty, many hesitate, not because they are foolish people, but because the decision lies outside their lived experience. Clinical medicine trains people to make decisions under uncertainty. Bureaucratic systems train people to minimize risk, especially legalistic risk. So the decision slows. More information is requested, more perspectives are gathered, more time is required. Eventually, the executives ask the clinicians what they think should be done. They listen carefully, they deliberate, and after a long discussion, they often approve or disapprove the same plan the clinicians proposed at the beginning. The system has moved, but it has moved in a circle. This is one of the paradoxes of modern hospital bureaucracy. Those with authority often lack the confidence to decide clinically. The system creates elaborate processes to reconcile the two. Meanwhile, the wards continue as they always have. Patients arrive in pain, nurses juggle workloads, doctors try to make the right decision in uncertain circumstances, and many clinicians quietly ask themselves how an institution built for care became so absorbed in managing itself. Hospitals are extraordinary places. They bring together science, skill, compassion, and teamwork. But like any large bureaucracy, they carry a risk. When the system becomes too focused on its own structures, its own meetings, and its own metrics, it slowly drifts away from its original purpose. A hospital exists for one reason: the patient who walks through the door. Everything else should exist to support that moment, not the other way around.